Hey everybody, it's Jason Blaha here. Today I want to chat with you guys a little bit about a strategy that a lot of advanced lifters use, and it's one that I'm using right now. And so I thought I would chat with you guys about it a little bit. Now, when I say that this is for more advanced lifters, I do not mean novice lifters. And that's kind of a point that needs to be brought home when we're giving advice. You have to be careful about mixing and matching this advice. Novice lifters generally need training minimalism. Right? They need to just get really good at a handful of exercises. They don't need a large amount of exercise variation. I'm not saying they don't need some. They don't need assistance movements, accessory work. They can usually train linearly and just adapt as they go. And they increase volume as they just increase weight over time. But they don't have always the same recovery factors to deal with because their work capacity can oftentimes increase linearly with their recovery and with their strength. That's one of the characteristics of a novice lifter. Noobs, that's how they operate, and it works very, very well. What starts happening is you start getting more intermediate and particularly oftentimes more advanced lifters. What happens is that our ability to generate fatigue can start to go up tremendously, and our training volume and training needs start to increase. We want to maximize gains in size and strength. Right, we have to start increasing total training volume and training stress. And there's a threshold that we reach to where we start to reach the ability to exceed what we can handle in terms of recovery. And we start getting into issues with possible overuse injuries. And so certain exercise variations can be useful here. So this isn't something that the novice lifter needs to worry about. In other words, if you're only squatting 300 pounds for a couple reps, on a back squat, or you're only benching 185 for a couple reps, this is not for you. You don't need to worry about this stuff. You're fine. But when you start to get more advanced, some things to look at are lifts like this to get more of your training volume in. Specifically, you take something like the box squat, and what we're looking at is reduced axial loading, and slightly less knee shear. And it's not to say that people can't get tremendously strong doing nothing but back squats. There are certainly some people with very powerful squats who are strong with massive quads, massive legs, who use just a normal back squat as a primary exercise. There's nothing wrong with that. However, if we're trying to, again, maximize total training stimulus while keeping our recovery in check, something like a box squat can become valuable. And it's because it does a couple of things. Because it reduces the axial loading because you're forced to use a lighter weight. You're forced to use a lighter weight because you simply can't lift as much because you can't use a stretch reflex the same way. So when you break up the eccentric concentric chain and you do it even more so than you do on a pause squat, you actually have the ability to bring certain muscles in the posterior chain in harder. But again, you can't use the stretch reflex out of the bottom because you have to start the weight from a dead hard stop. You usually have to use slightly less weight. And that weight can be as much as 10%. Some people say 15. I think that's a bit aggressive. I'd say as much as 10% less than what you can do on a normal back squat. Well, the thing is we're getting similar levels of muscle activation with a slightly lighter weight. And while that might not seem like a lot, people say, well, 400 pounds versus 360, 10% lighter isn't really a massive difference. It's not. It's 10% difference. But when we start thinking in terms of training load and how many total reps can you handle with that and still recover from it, you're probably going to find that you can handle a couple more reps in a session. In other words, we start looking at tonnage generated. We can probably do 10% more reps to get to the same tonnage, similar amounts of fatigue and axial loading generated. All right? We can do more work. And each rep, we're still hitting upper threshold fibers and a large number of muscles. So from a training volume perspective, we can do a little bit more work. Also, not just axial loading, you look at things like stress on the knee. That actually came up in the Q&As the other day. Someone had said their orthopedic surgeon had them switch to back squats after a knee surgery. Yeah, it's less knee shear. It's less shear stress on the knee joint. So when you factor those two things in certain ways, you can have a little less wear and tear. Now, is that a problem for a healthy first-year lifter? Not at all. they probably are not going to be able to really squat enough to bury themselves as long as their food and everything is on point. They have healthy knees, strong knees, everything else. They're doing posterior chain work like, deadlifts and other stuff and training their core. They're not going to have the same concerns, right? They're going to be just fine, particularly if they're keeping their hamstrings and everything strong with deadlifting. Their knees are going to be just fine. However, as we start to get more advanced, it is easier to get overuse injuries. So that reduced knee shear, and particularly if you're working it back and forth, you're doing some back squatting, but you're doing a little more volume, or you're more volume-oriented training with the box squat. Like in my case, I do like around 12 sets of box squats for dynamic work on my higher volume days. That is just simply less stress on the knee, less total compression, less axial loading on your spine. And you still get a maximum training effect, really, not just a great one, a maximum training effect if you go near your maximum recoverable volume. So again, works very, very well in terms of mitigating fatigue and maximizing training stimulus. Then you take something like the sumo deadlift. We have a similar situation. It's not necessarily less axial loading per se, because most people can sumo deadlift as much as they can conventional. Some people can do a little more on one or the other, depending upon their individual biomechanics and levers and moment arms. So it varies a little bit from person to person. So why the sumo? Less lower back is used, but more hips are used. So we get into the situation of a trade-off. So in the sumo deadlift, you might find that it fatigues your hips a little more, but it fatigues your lower back less. Well, less lower back fatigue has led some coaches who work with it to find that they can actually do a little more volume with their athletes on the sumo deadlift than the conventional. Well, that matters. That absolutely matters when we're trying to manage total fatigue, especially if, say, lower back starts to become a fatigue issue. Or we're concerned with overuse injuries, with too much loading of the lower back, and we need a little bit of a break from it. All right, working in sumo deadlifts for a bit of your volume can do that. Now, you might end up with a situation to where your hips are getting a lot more fatigue. But the point is that we have the ability to shift that fatigue. So variations like this, particularly variations like this, that put a little less stress on the lower back, over the grand scheme of training over months, and when we start approaching very high amounts of volume and start approaching our maximum recoverable volume, these things can start to matter. Just like I'll say the same thing with deficit deadlifts, right? Deficit deadlifts have a little less axial loading, but similar amounts of training stress to a conventional deadlift. So we see the same thing when we start talking about a sumo deadlift. Now, does it have similar amounts of axial loading? Of course, but there's still less stress specifically on the lumbar region of the back, which for many people can be a limiting factor in your total training volume, training frequency. All right. So you see where we're going with this? We have a case of one of these two exercises is less total axial loading, so just less loading on the spine in general by as much as 10% less. And then we have a deadlift variation that takes some of the extra work being done by the spinal erectors and transferring some of it towards the hips. So what we're doing is we're also getting some variations in for our higher volume that might be slightly different from some of our heavier work, that's giving us less chance of overuse injuries in the same regions. So we can get really good muscle gains, and we have very good carryover to the other lifts, because the box squat does increase the back squat. The sumo deadlift does increase the conventional deadlift, but this allows us to get a little more of our volume training in with variations that can be slightly easier to recover from. And like I said, it's a subtle difference, which is why for the more novice lifter, this doesn't matter. It doesn't matter that much. But most novice lifters aren't doing that much total tonnage. They really aren't. They're not moving as many total pounds on these big lifts as the more advanced lifters are, because people need to remember that more advanced lifters need not just more weight, sometimes they need more total work reps, more quality reps per week to stimulate maximum growth. And it becomes very, very hard to make gains the more advanced you get. So using tools like this and having tools like this available in our toolbox gives us some variety, gives us some variation that allows us to do sometimes a little bit more training volume when we need to get that training volume in. and do so in a way that's not only slightly easier to recover from, but might reduce overuse injuries because it stresses some of the connective tissue and joints slightly differently than the other very similar big lifts. So it can start to reduce our chances of getting overuse injuries. And people need to remember that overuse injuries start to become a far bigger problem as training volume and training workloads start going up chronically. So again, these are just tools that we have available to us. I'm not saying it's the right or wrong way to do it. I'm not saying it's the only way to do it. It certainly isn't. But it is a tool that we have available and one that people can consider and look at as far as their total training programming. All right, guys, but that's really all I have to say on that today. I hope it's been informative, and I will talk to you guys next time.